I get the question a lot about when do I decide to see a psychologist versus a psychiatrist. So a lot of people, don't believe in mental health or don't believe in treating it, and that's a lot of people. And they say, well, you just need to exercise more, and you need to, and I talk to patients all the time about exercise. It's very important for your mental health, your physical health, your just everything. And so it's not like I don't bring that up. It's just when the person is seeing me, they're usually at the point where they've tried things and they haven't worked. And so when I work with a lot of therapists, with psychologists, and so referring someone to a psychologist probably if there's really underlying issues that need to be addressed. There's marital issues, maybe there's relationship issues. Maybe there's trauma from childhood. I mean, a lot of people have traumatic childhoods, whether it's being abusive childhood, physically, sexually is the worst. Just cruelty, over punishment. So a lot of people have traumatic childhoods, and that's difficult to get past. So these people like that, and people who have I see a lot of people with PTSD. I see people from the Korean War, even in their 80s, or Vietnam in their 70s. So see PTSD. Therapy can be helpful. The best kind of therapy for trauma is actually EMDR therapy, which is a newer type of therapy that you have to be trained to do it as a psychologist. Not all of them do it. The normal is the average therapy we call CBT, or cognitive behavioral therapy. And then there's a video that I did on the show with Kim Quickle, and we talked about that. If you want to look that video up. But there's different types of therapy, and therapy can be helpful. I mean, some people definitely get value, and they'll tell me that definitely helps me, and that's great. When does medications come in? Well, medications come in when, in my view, the earlier the better, in a sense, because people might say, well, how do you know it's chemical and not just situational? Well, it depends on people's history, and when I take a history, and it's something that's going on for a while. It's not just a recent thing that happened or a recent stress. It's more of a longer standing symptoms of anxiety or depression that have gone on for a while. And so I'm a big believer in being very proactive. I mean, me, I'm very pro-medication because it's my job, it's what I do. So really, how do you know? You try it. I mean, what do you have to lose? I mean, so if you don't know if it's chemical, try an SNRI or an SSRI and see what happens. And if you get results, it means, okay, there's an imbalance. So you kind of know afterward, because there's no way of measuring these things. I can't do a blood test. I can't do a scan. I can't do anything that says, oh, this is off, your serotonin's off, your dopamine's off, that's not available. So how do you know? It's trial and error, because if I believe it's a certain imbalance and I give something to correct that imbalance, and if it works, then I was right. Let's say it doesn't work, then I have to look at it again. I have to think, okay, well, maybe it's not that, so maybe it's this. So it's a lot of that, testing things out, and sometimes it takes a visit or two to really figure out a person, how they tick. And everyone's different. And so it's a very individualized how I do things based on their history, based on a lot of information I get. Usually I spend a good hour with a person on the first visit to get a lot of baseline information, genetics, family history, hormonal history, trauma history, etc. What have they tried in the past that didn't work or did work? So a lot of goes into making these decisions. And then, again, I make a decision. I have them call me back in a week without an appointment, just to check in and tell me how. So I with all my new patients, I always have them call me in a week. Why? Because within a week, you're going to know if what I gave you is going to help or not. You're going to know if there's side effects. You're going to know if it's helpful. The whole notion that it takes medications 4 to 6 to 8 weeks to work is a complete nonsense. You're going to read it. Even the psychiatric books, it's going to say that it's never been true. It takes no more than a week. Most medications that I work with, no more than a week, maybe 2 weeks at the outside. Maybe for SSRIs, it might take a little bit longer than a week, but for the most part, they're quick. So you have the answers quickly, whether it's the right choice for or a wrong choice. Let's say it's the right choice and it gets people, maybe 50% better. Good, and that's a good start. But what I'm interested in is, okay, how can I get them to 100%? I mean, they're 50%, which is greater than they were here, but I'm looking to get them to the next level. And so that's when I make decisions about what to add. Okay, well, maybe we should add some Wellbutrin. Maybe we should add an atypical, like Rexulti or Vraylar. Maybe we should add Lamictal. Maybe we need to. So I'm able to figure out, by history and by doing it, is it a more common unipolar depression? Is it a bipolar depression? Is it, so you kind of can figure that out pretty quickly because with me, it doesn't usually take more than a couple visits, maybe 2 to 3 visits to get most people really much, much better. A more complex person, it might take 4 to 6 visits to really figure it all out and get everything in place. And these are people that might be on 4, 5, 6 medications, and people might think, oh my God, that's horrible. No, it's not. Ask them how horrible it is when they've been feeling the way they've been feeling for years, and then all of a sudden they feel better. And so what, how many they take? I mean, if someone has heart disease and diabetes and cholesterol, they're on probably 6 things right there. And no one's going to say, oh, you should go off your heart medications. Of course not. What are you talking about? So yeah, because this is, people don't really take it seriously. They don't think it's a medical problem. They think it's just a mental thing. Well, mental, yeah, but you got to break it down in there. What do you mean by mental? And I ask people that, what do you mean mental? And they go, I don't know. I said, well, what's, or what's, I think it's all in my head. I said, it's all in your head. Okay, well, what's in your head? And they'll look at me like, what do you mean? I go, what's in your head? Your brain. And that's a really important organ, by the way. And if your brain isn't working correctly, it can affect your whole body. It can affect everything, your mood, your physical body, everything. And so yeah, it's very important for me to get past the whole anti-medication mentality with people. That's not always very easy. Some people don't follow through with what I recommend, and I can only help people if they can follow through with my recommendations, and it's because I have to figure it out. And if people just don't feel comfortable with it, then I can only help them so much. More often, men are more stubborn about things than women, in my experience. So with men, they don't want to feel weak. They want this macho thing. Women are already, I think, more communicative. Women are more accepting of the fact that they need help, and I think women know because they know that they're not in control of their bodies. They have hormonal stuff happening, and women already have a sense that things are going wrong, and so that's why women are a little easier to communicate with, and they're more compliant with treatment too. So anyway, but that's kind of and then sometimes, hey, you need both, maybe it's medications and counseling. There's studies that show that both together is actually better than either alone. So it's not like it has to be one or the other. So anyways, hopefully that helps. If you have any questions, feel free to contact me.